Welcome to the 517 In Your Business podcast. Here's your host, Mary Gaida.
Thanks for joining us on 517 In Your Business. We'd like to welcome Eric Hanna, VP Employee Benefits for Risk Strategies. Thanks for being a guest today, Eric.
Well, thanks for having me. I've been looking forward to the conversation.
Yes, me too. So tell me first, what does Risk Strategies do?
Yeah, thanks for asking that. At Risk Strategies, we specialize in providing expert risk management, consulting, insurance solutions, specifically designed to meet the unique needs of businesses. So we have a national footprint and with localized expertise across a number of industry specialties. We provide expert advice, solutions, and a consultative approach, specifically in areas like commercial insurance and employee benefits, among a couple others.
Okay, so you are actually a registered employee benefits consultant. Tell me a little bit more about what that role involves.
That's a great question. I mean, it sounds like, one of those things that, everybody's heard that term, but we're often working behind the scenes with businesses. For most businesses, employees or people, are the second or third largest expense. And we're supporting their delivery of total rewards or their total compensation. Obviously, everybody knows, their salary and wages, and that's really the business's responsibility to deliver to their team members. But what rounds out that part of the equation are their benefits. And most people think of that around health insurance, dental, vision, disability, and life. That's traditionally what we think about in benefits. From my perspective, there's really a new frontier in benefits that goes well beyond just an insurance product. So that's my main role in my engagement with businesses.
And you work with all the leadership, right, to develop all these things,
Right.
the CEOs. Tell me a little bit more about that.
Yeah. Historically, like I said, our role has been to quote insurance as a benefits broker, but to me, that's kind of the easy part. I lean really into becoming a trusted business advisor, similar to a CPA or a legal counsel or somebody in that realm. So I work with business leaders, sometimes CEOs, finance, HR, maybe a combination of a team, depending on how they kind of champion benefits at building what I'll call multi-year strategies to improve the employee and buyer experience while also balancing and managing the costs. All right, so I'm regularly communicating with business leaders on how to effectively roll out their benefits, stay competitive in the job market, which is highly, highly competitive right now, and making sure that they see what options are in the market for them to offer.
You have to obviously work really hard and be passionate to do this sort of work. Tell me a little about your background and what makes you so passionate.
Well, I appreciate that. If you looked at my LinkedIn profile, you might think that I've made some distinct pivots in my career, but I actually see my background as being one arc, and it's all built on itself to where I am today. I have 20 years of experience in healthcare in mid-Michigan, and I've sat at different seats at the table. I've been a decision maker and leader at several healthcare organizations, including rehab facility and an administrator of some specialty medical practices in orthopedics and dermatology. And in those roles, I was part of my role was developing and implementing employee benefits programs for those organizations. So I sat in the seat of a business leader trying to navigate these really complex options, and I understand uniquely the direct challenges that leaders are facing. So also, when I was in healthcare administration, I was directly involved in how providers get paid by insurance systems. So you round that out with my experience today and now consulting with businesses and being an advisor in this realm, I kind of know how the sausage is made in this space. So I know how employers are paying into the system, this insurance system, and I know how providers are getting paid out of it. I know where there's waste, and we can develop these high-performing benefits packages that, like I said, balance both experience and cost.
So this experience really just gives you a leg up on everybody else because you know all of the ins and outs.
Well, I like to think so. I mean, it's complicated and it moves fast, and it's just become a space that what has built into the passion part, back to your earlier question, is I want this to be the best experience possible for the employer, and then ultimately have them be really have a valuable relationship with their employees, and their employees identify the great benefits that they're being offered by their employees. So the more that I can help an employer, be seen as a great employee experience by their team members, that's where I get excited.
And I love the phrase you used, how the sausage is made. I've never heard that. I love it. I'll be using that going forward. It makes so much sense. Talk to me about, as you work with some of these companies in these leadership teams, what are the top priorities and challenges we're facing right now? I know the times are unique.
Yeah, like I said, it's a pretty tough job market right now, and I think when it comes to the people part of the equation for businesses, recruiting and retaining top talent's got to be at the top of their list, right? We're in a highly competitive job market. The average length of the employee time with an employer is declining nationally. It's currently about 4 years. And we have multi-generational workforces that have different wants, needs, expectations. They're at different phases of their lives. So what's important to them is different. Um, so I try to help those businesses put dynamic programs in place so that it's meeting the needs of as many people as possible within their workforce.
And transparency has to be a big part of everything.
Oh, it's huge. It's huge. And, if there was the one tip, right now, a lot of employers we're sitting here, in the early July right now, and a lot of employers have their renewal around January time, their insurance renewal. So, for those who are employees, that you do open enrollment where you
Right.
elect your benefits in the Q4, and then they're effective January 1. We're mid-year. So as much as employees or employers, excuse me, can communicate to their employees about the great benefits they're offering, that's usually the first tip out of the gates that I try to provide to employers. Be transparent with the team where it makes sense. This is hard stuff. It's not inexpensive. And I think most people would agree that healthcare is complex when we're talking about the healthcare benefit, which is usually the top tier of employee benefits, or at least one of them. That healthcare specifically is complex and not very transparent at times. And so communicate that everybody's working their way through this challenge. And, like I said, most companies are renewing in the fourth quarter time leading into January 1st. And too often employers are only communicating about benefits one time a year. And that's a lot for employees to consume at one time. So as
Right.
much as you can break down those benefits throughout the year, break them into small bite-sized chunks, make sure that the employees are aware of their resources, then I think it really puts the employer in a position of continuously reinforces, one, how great the benefits are, and two, how best to use them from the employee side.
Let's dig in a little bit to the rising costs. The costs are just getting a little out of hand for some. I can't imagine being an employer that has to be responsible for all of this.
Yeah, it's a huge challenge, and health insurance, if we're strictly looking at insurance as a product, is really increasing at what I would say is an unsustainable rate. What we call medical trend is increasing double digits every year. Employers are routinely seeing cost increases in the 15 to 20% range annually. So, I mean, their cost is almost doubling every 4 or 5, maybe 6 years. That's significant, and it's hard to consume when you have a consumer market on the other side pushing down on the price for them to deliver their service, right?
Right.
So if an employer wants to take a look at, how do they get out of the normal cycles, there's a couple things that I would offer. One is take a broader view of the options that are in the marketplace. The insurance product offerings historically have been fine with kind of a one size fits all approach. And like I said, there's kind of a new frontier now where we can make these benefits more dynamic, where employers are only paying for what's being used. So we look deeper behind the curtain to see how are employees engaging the benefits that they have and how are they using them and what are the cost drivers behind it. Most insurance plans are being driven by a couple of things, but really the one that's on everybody's radar right now is the cost of prescription drugs.
Yes.
I think you see it kind of in the public domain and the news and all this kind of stuff. It used to be, 10 to 15% of a health plan cost. Now sometimes it's 30, 40, 50% of the health plan cost is prescription drugs. New specialty drugs can be $120,000 to $150,000 a year. And the way this insurance system works is employers are really the ones trying to figure out how to support that and still deliver the benefit on the other side.
Hmm.
And some of these more dynamic solutions, we can become buyers like we do in the rest of our life, where we shop and we see pricing and we understand how to go to different places to buy different products and services. And, long story short, we can redesign how we become buyers in prescription drugs, and got a couple of examples where we've had those $150,000 a year medications that we've been able to deliver to employees for free. And, I've got one great example, and actually multiple, but this one I'll mention now is there was a prescription for what was $1 million prescription. And we are able to source it for $15,000. And for employers
Wow.
over 50 employees, that directly relates their cost in future years. And so again, if we can think more like consumers from the business side, we can redesign where and how we engage the healthcare system. So yeah, it's fun to get those outcomes. It's a challenge that they're recurring at the rate that they are, but those are just some of the things that, that we can do from that sort of broad offering perspective.
Right. It's so important. Let's talk about the administrative burden as well.
Yeah, business leaders are being asked to do more with the same or less or fewer resources at times.
Hmm.
Regulatory requirements, fiduciary responsibility, which is the employer's responsibility to make sure that the pricing is reasonable or where it should be. And these complexities are just increasing demands. And so, if we look at one tip in that space is I would look right at technology, and brokers should be offering, more advanced tech solutions so that you're breaking down barriers for the employees without taking on more responsibility as an employer. So looking at this, particularly health insurance, through a different lens, it doesn't necessarily mean that it becomes more work for the employer. It becomes what tools can we put in place to maximize the efficiency and also engage the employees in different ways.
Boy, that makes so much sense. And that's why it's really important to consult with someone like you at Risk Strategies. Anything else that you want anyone listening today to know?
Yeah, it's great. Thank you for asking that. We Risk Strategies, and I'm happy to be a support system for any business, particularly in our community. We've got a lot of great content and information, benchmarking reports, white papers, all kinds of things that if people are struggling in where to evolve their benefits to or from, I'm happy to be a resource. So if somebody wants to look me up on LinkedIn, that's great. I'm pretty active there to have lots of posts and content around some of these concepts. But yeah, feel free to reach out to me at any point. I'm happy to be a resource.
Well, we appreciate you so much spending time with us and letting us get in your business today. And hopefully we can talk again and get a little more in depth on these things because you have some very important information.
Oh, thanks, Mary. I appreciate it. Yeah, looking forward to a conversation sometime in the future.
Thanks for listening to the 517 In Your Business podcast. Get to know local businesses better by reading 517 Business Magazine. Get your subscription at 517mag.com/subscribe.